there.
We all want to get in on the Hovind press conference, but
We were wanting Gene Simmons here a minute ago.
is he here?
Just a couple of minutes ago, you missed him.
The heck! All right, that's my part of
You're
my
gonna vote on the Gene Simmons plan?
part of my misspent youth. Yeah, listening to Kiss. Well, good afternoon. As you all know, we're going to have a vote this week on Thursday on a Democrat proposal to deal with the Biden COVID bonuses. And this is a vote, as you all know, we could have had weeks ago. It's been on offer now before we had to go through a 43-day government shutdown. But that's what the Democrats opted to do. And so at the end of the 43 days now, we're going to have a vote on their proposal, which, as it turns out, is really a proposal that just extends the status quo. Doesn't do anything to reform these Biden COVID bonuses in a way that would get rid of the waste, fraud, and abuse. And I think the one thing that's clear about this, and I think you all who follow this subject know this, that the way that the program is structured, the money goes straight to the insurance companies. And the way that we think this ought to work is you ought to come up with a way in which you can deliver the benefit to the patients and not to the insurance companies, and that you shouldn't have hardworking Americans subsidizing affluent people who make a lot of money. And that's what their proposal continues to do. There is no income limit. There are $0 premiums. There are millions of Americans who don't even know they have coverage, and they have decided not to do anything. Zero reforms to this program. And so the bill that they're going to put on the floor will fail. But that doesn't mean that there isn't a path forward here. We also will have a vote. Our members have decided that we're going to vote on a Crapo-Cassidy proposal, which does the things that I mentioned. It actually does make health insurance premiums more affordable. It drives down, according to the Congressional Budget Office, premiums by double-digit levels. It delivers the benefit directly to the patient, not to the insurance company, and it does it in a way that actually saves money. So to the taxpayer. That is a win-win proposal. So that is an alternative that we will put forward and that we will have a vote on Thursday. And we'll see where the Democrats come down on that. But the fact of the matter is that as long as we have been talking about this subject, and again, they drug us through a 43-day government shutdown in order to do this. Just in the last week, the Government Accountability Office came out with a finding and an audit that they did. There were 19 fraudulent claims made to this program, or 20 I should say. 19 got through. In other words, 95% error rate. When I say waste, fraud, and abuse, I am not kidding. That is the finding as recently as this last week by the Government Accountability Office. This program desperately needs to be reformed. The Democrats have decided we're not going to do anything to reform it, and so we'll see where the votes are on Thursday. But we will have an alternative that we will put up that reflects the views of the Republicans here in the United States Senate about how to make health insurance more affordable in this country, how to ensure that it's not the insurance companies that are getting enriched, that it's actually benefiting the patient, and how to make sure that this is a good deal for the American taxpayer. John Brasso.
So this week we are going to vote on a Democrat proposal to send $83 billion directly from the federal treasury to the bank accounts of insurance companies. And that is going to cause the cost of health care in this country to continue to go up. I'm a doctor, practiced medicine in Wyoming for 24 years. People need the care that they need from a doctor that they choose at a price they can afford. And that all went away with Obamacare. I remember President Obama saying, oh, if you pass this, your premiums will go down by $2,500 a family a year. Instead, premiums doubled. So what happened? Well, the Democrats wanted to hide these premium increases, so they said, we better send a lot of money directly to the insurance companies. Don't let the people see it. Send it right to the insurance companies. The insurance companies loved it. Premiums went up 221%. And the stock of the insurance companies went up 500% to 1,000%. That's what happened with Obamacare. And now at this point, over 90% of premiums are subsidized by the federal government. Obamacare was always pricey. It was never affordable. And then during COVID, people saw this and said, well, Democrats said, this is bad, as prices keep going up, what do we do? They said, we need to put new subsidies on top of the old subsidies, and that is the Biden COVID bonus subsidies. Those are the ones that are expiring at the end of this week. What happened? Well, the Democrats chose that date for expiration, but they also removed any income limits. You can make $1 million a year and you're still getting all the subsidies from the federal government paid in your name directly from the government to the insurance companies. And now they want to send another $83 billion. That's going to be the vote this Thursday. They're not going to pay any attention to the reforms that are needed because of the waste, the fraud, the abuse, and the corruption. And in just today's Washington Post, the editorial in today's Washington Post, Obamacare subsidies make it too easy to scam the system. That's what's happening. This system is full of waste, fraud, and abuse because they make it too easy to scam the system. Well, I oppose sending these payments directly from the federal government to the insurance companies. They shouldn't be rewarded for what they have done. Money should go directly to patients so they can make their own decisions. And that'll drive down costs, make insurance companies compete to the people that are actually paying the bills, the taxpayers. Make them offer things that those patients want to have insurance, not held hostage in the straitjacket of the one-size-fits-all that is Obamacare that is hurting our country today.
Leader Thune, good afternoon. Can you speak to, for a moment to the political concerns of vulnerable Republicans if Obamacare, health care, these subsidies aren't addressed in some form going into 2026? The president's talking about affordability.
Mm-hmm.
The president's talking about affordability. What
Yep.
happens to your side if you don't address this?
Well, and so are we, and which is why the proposal we will put out there will actually drive premiums down. And that is in stark contrast to, as Senator Barrasso just pointed out, a program that since its inception has increased costs, premiums in the individual marketplace 221%. That is triple the CPI and double what the rates have increased in the group market, the employer market, where a lot of people, about 150 million Americans, get their insurance. This is a failed program, and it does nothing but drive premiums up, and the increase in premiums, who's that going to? That's going to the insurance companies. So the proposal we'll put out there will bring insurance premiums down. It will be fiscally responsible, and it'll get us away from the practice of giving the money all to the insurance companies and put it back in the hands of the patients. So there will be something out there that Republicans will be able to talk about and support and vote for, and then we'll see. I mean, what happens on Thursday? Maybe there's some wise Democrats who will decide to vote for a proposal like that. But if there aren't, if neither proposal gets 60, then we'll see where it goes from there. But I do know that we want this issue, affordability, to be front and center. And the way to do that is not to extend for 3 years at a cost of $83 billion to the taxpayers a program that continues to drive insurance costs, premiums higher and higher for the American people.
On these Venezuelan boat strikes, a number of your members this morning said they would support releasing a video of that September 2nd strike publicly. Would you personally support that?
Well, I'm happy with what they are doing. I think they are, the relevant committees, as I've said before, the Armed Services Committee, both Democrats and Republicans have had an opportunity to view that video. How they decide to proceed with it, I'll leave to their, to their discretion. But I think anybody who probably wants to, any member who wants to see that, I suspect probably would have that opportunity if they choose to.
Given the uncertainty of the tariffs with the Supreme Court decision potentially overturning them, does it make sense for the president to turn to those tariffs, that tariff revenue, to pay for farm aid, and tariff revenue goes into the federal treasury? Isn't it the Congress's power to spend that tariff revenue as it sees fit?
Yeah, I mean, for those of you who've been following farm policy for a long time, which I have, I've been through 4 farm bills. The one we're working on right now that got derailed, but we got a lot of it included in the reconciliation bill last summer, would have been my 5th. And throughout the years, there have been attempts, and obviously this is the most recent one, to deal with tremendous losses that are being experienced in the agricultural marketplace, in this case because of a loss of markets. And that is related to some of the trade issues that we're dealing with. The President's obviously trying to get the attention of the Chinese, get us into a better place in terms of reciprocity with them. But in the meantime, it has an impact on the markets that a lot of our agricultural producers have access to. So to me, it makes all the sense in the world that if you've got a lot of revenue coming in from tariffs, and you need sort of a bridge for farmers. A lot of the changes that we made in last summer in the reconciliation bill don't take effect until next year, and the farmers, the safety net programs, will benefit from those. In the meantime, to have something that helps them bridge that time when they've had this loss of markets and are experiencing historically low commodity prices and historically high input prices. The margins in agriculture are gone. And I say that for corn and soybeans, other commodities, but those two in particular are where we've seen a real impact. And I think the administration's trying to respond to that and ensure that the farmers get to a time where we have that market is opening up again, China's opening up again, so hopefully this will be a bridge to the future. But I think what the administration did in terms of using tariff revenue to do that makes sense.
Just on the Venezuelan boat strike again, I know you say that all your members have access to that video, but they're coming out with a dramatically different interpretation of that video. Isn't that one of the reasons for the administration to be transparent and release the video for all Americans to see?
Well, look, I think, again, I think that the relevant committees here on Capitol Hill, that has been made available to them. And I'm going to leave it up to them to decide who has access to it. But as I said before, I think any member of Congress, and certainly people are going to come up with different interpretations because we live in a political environment. And, but I suspect that anybody who has seen it knows pretty clearly what the facts are. And I'll leave it at that. I think that the relevant committees will make decisions about who has access to it.
Back on healthcare, does Cassidy Crapo have unanimous support in your conference? And some of your members have also put forth temporary 2-year extensions of the ACA with changes with hide language with other reforms. Might those come to a vote as well?
Well, we have other members, as you point out, who have their own proposals, and they, you know, you have to ask them how they want to have those dealt with. But I suspect you may see others advanced, other ideas advanced, and whether or not those get voted on, I think is going to be probably up to some of our colleagues who are offering those proposals. What I can tell you is, as a conference, our members, and I can't say 100%, but I think for the most part, I would argue are united behind the Crapo-Cassidy proposal, which, as I said, in terms of its emphasis, is about patients, not insurance companies, and about lowering premiums, not increasing them, and about getting a better return for the federal taxpayer. Thank you all.